Ever wondered how doctors can access your spinal fluid or administer anesthesia directly to your spine? The answer is a procedure called a spinal tap or lumbar puncture. This procedure is a cornerstone in the medical field with several crucial applications. Imagine a scenario where a doctor needs to diagnose diseases like meningitis or multiple sclerosis, or perhaps you're about to undergo a surgical procedure, and anesthesia needs to be administered directly to your spine. In these situations, a spinal tap becomes an invaluable tool. It's a procedure that allows doctors to collect a sample of your cerebrospinal fluid, or in some cases, deliver medication directly into your spinal canal. As fascinating as it sounds, it's also intricate and requires a solid understanding of the body's anatomy. So that's a snapshot of what a spinal tap is. Now let's delve deeper into how it's actually performed. The first step to understanding a spinal tap is to have a clear picture of the human spine. Our spine is more than just a structural support for our body. It's an intricate system that houses and protects the spinal cord, a bundle of nerves that transmits messages between our brain and the rest of our body. This marvel of nature is composed of 33 individual bones called vertebrae, stacked one on top of another, forming a flexible column. Now let's zoom in a bit. The vertebrae are divided into 4 main regions: the cervical, thoracic, lumbar, and sacral. Each region has a unique structure and function. But for a spinal tap, we're primarily interested in the lumbar region, situated in the lower back. The lumbar vertebrae are larger and stronger than the others, designed to bear the weight of the upper body. It's also the region where a spinal tap is usually performed. Why? Because below the first or second lumbar vertebra, the spinal cord ends and gives way to a bundle of nerves known as the cauda equina. This makes the lumbar region a safer option, minimizing the risk of damaging the spinal cord during the procedure. Within this bony fortress of vertebrae, ensconced in protective layers, lies the spinal cord. Think of it as the superhighway of our nervous system. And within this superhighway flows a clear, colorless liquid called cerebrospinal fluid or CSF. This fluid acts as a cushion for the brain, provides nutrition, and carries away waste. During a spinal tap, a needle is inserted into the lower back, into the spinal canal, to collect a sample of this CSF. It's a procedure that requires a deep understanding of the anatomy involved, skill, and precision. So, there you have it. A quick tour of the spine, the spinal cord, and the cerebrospinal fluid, all key players in a spinal tap. With this understanding of the spine, we can now move on to the actual procedure. Performing a spinal tap involves several key steps, each requiring precision and care. It's a medical procedure that's been honed over years of practice and study, and today we're going to break it down into easy-to-understand steps. First, let's talk about patient positioning. It's essential to get this right, as it can significantly impact the success of the procedure. The patient needs to be positioned either lying on their side or sitting up, with their back curved outward to widen the spaces between the vertebrae. They need to stay as still as possible to avoid any complications. Next, we move on to the area of insertion. This is usually in the lower back, specifically between the 3rd and 4th lumbar vertebrae. Why this location? Well, it's below the level where the spinal cord ends, which reduces the risk of accidental injury to the cord. The skin over this area is cleaned with an antiseptic solution and then numbed with a local anesthetic. Now comes the critical part, the insertion of the needle. Using a special needle, the doctor carefully punctures the skin, moves through the underlying tissues, and finally pierces the dura mater, the tough outermost layer of the meninges that encase the spinal cord. The needle's journey doesn't stop there. It continues to pass through the arachnoid membrane, a middle layer of the meninges, and enters the subarachnoid space, where cerebrospinal fluid, CSF, is located. This brings us to the next step, the collection of the spinal fluid. Once the needle is in the correct position, cerebrospinal fluid starts to flow out of it. This fluid is then collected into test tubes. The amount of fluid collected varies, but it's typically between 1.5 to 2 teaspoons. After the fluid has been collected, the needle is carefully removed, and a small bandage is placed over the puncture site. The patient is then instructed to lie flat for several hours, as this can help prevent headaches, a common side effect of the procedure. And there you have it, the spinal tap procedure broken down into simple steps. From the patient's positioning to the moment the needle is removed, every step is crucial and requires a high level of skill and precision. It's a fascinating procedure, isn't it? But it's just one way we can access the central nervous system for diagnostic or therapeutic purposes. Another method is epidural anesthesia, which involves inserting a needle into the epidural space rather than the subarachnoid space. That's the basic procedure of a spinal tap. But what about epidural anesthesia? Let's find out. Epidural anesthesia is another procedure that involves the spine, and it's commonly used during childbirth. This technique is a highly effective method of pain management that numbs specific parts of your body to block pain signals from reaching your brain. But what exactly is epidural anesthesia? It's a regional anesthesia that blocks pain in a particular region of the body. The goal of epidural anesthesia is to provide analgesia or pain relief, rather than complete anesthesia, which would be total lack of feeling. It's essentially a way of managing pain without putting the patient to sleep. This technique is commonly used during labor and childbirth. However, it's also an important tool in other surgical procedures, such as those involving the lower limbs or abdomen. With its targeted approach, epidural anesthesia allows patients to remain conscious and comfortable throughout procedures. Now that we've established what epidural anesthesia is, let's explore how it's performed. Just like the spinal tap, performing epidural anesthesia requires skill and precision. Let's break down this procedure into simple, digestible steps. First, it's all about positioning. The patient is typically placed in a sitting or lateral position, with their back curved to maximize the spaces between the vertebrae. This position allows for easier access to the epidural space. Now, onto the main event, the insertion of the needle. The healthcare provider, usually an anesthesiologist, will identify a suitable point in the lower back, often between the third and fourth lumbar vertebrae. The skin is then sterilized, and a local anesthetic is applied to numb the area. Once the area is numb, a larger needle is introduced into the skin. This isn't just any needle, it's a 2-0 needle, designed specifically for epidural procedures. Its curved tip allows for better control as it's guided through the layers of tissue. The needle journeys through several layers. First, it passes through the skin and subcutaneous tissue. It then punctures the supraspinous and interspinous ligaments, followed by the ligamentum flavum. This ligament is thick and yellow, hence its Latin name, and provides a telltale change in resistance that signals to the anesthesiologist that they are at the door of the epidural space. The needle is then carefully advanced into the epidural space. This is a potential space, meaning it's not usually open but becomes so when a needle or catheter is inserted. It's located between the dura mater, the outermost layer of the spinal cord, and the inside of the bony vertebral canal. Now here comes a critical step. To confirm that the needle is indeed in the epidural space, a loss of resistance technique is often used. This involves injecting a small amount of saline or air through the needle. If the needle is correctly placed, there will be a sudden decrease in resistance. Once the needle's position is confirmed, a tiny catheter is threaded through it and into the epidural space. The needle is then removed, leaving the catheter in place. This catheter will deliver the anesthesia. So what's in this magic potion that numbs the body? The epidural anesthesia mixture typically includes a local anesthetic, which blocks nerve impulses, and a narcotic, which reduces pain. The specific combination and dosage depend on many factors, including the patient's health, the type of procedure, and the desired level of numbness or pain relief. The anesthesia is then administered through the catheter. This blocks the transmission of nerve signals from the lower body, resulting in loss of sensation and pain relief. The effect can be maintained as long as needed by administering additional doses through the catheter. And that's how epidural anesthesia is done. But how do these two procedures compare? While both spinal tap and epidural anesthesia involve the spine, they are used for different purposes and have different procedures. Let's take a closer look at the spinal tap first. Also known as a lumbar puncture, it's a diagnostic procedure where a thin needle is inserted into the lower part of the spinal column to collect cerebrospinal fluid. This fluid is then examined in a lab for signs of diseases like meningitis or multiple sclerosis. It's a bit like a detective collecting clues to solve a medical mystery. On the other hand, epidural anesthesia is a therapeutic procedure aiming to provide pain relief, especially during labor and childbirth or after surgery. The needle is placed in the epidural space, which is just outside the membrane that protects the spinal cord. A local anesthetic is then injected, which numbs the lower half of the body, allowing for a pain-free experience. It's more of a bodyguard, protecting you from the onslaught of pain. The point of needle insertion also differs. For a spinal tap, the needle is inserted between the third and fourth or fourth and fifth lumbar vertebrae. For an epidural, it's usually between the fourth and fifth lumbar vertebrae, or the fifth lumbar and the first sacral vertebra. Yet, both procedures share similarities. They both involve the spine, are performed by highly trained medical professionals and require the patient to stay very still. Both can cause a bit of discomfort, but they're generally safe when done correctly. But here's the kicker. A spinal tap can provide valuable information for diagnosis, but it doesn't provide relief from pain. An epidural, however, doesn't help in diagnosing diseases, but it can provide significant pain relief. It's like comparing apples to oranges. They're both fruits, but they serve different purposes. So, whether it's diagnosing a disease or providing pain relief, these procedures play a crucial role in medicine. Let's recap what we've learned today about spinal taps and epidural anesthesia. We started our journey by introducing the concept of a spinal tap, also known as a lumbar puncture. We learned that it's a procedure where a needle is inserted into the lower part of the spinal column to collect cerebrospinal fluid. This fluid can be tested to diagnose conditions like meningitis, multiple sclerosis, or even cancer. Then we delved into the intricate anatomy involved in a spinal tap. We learned about the layers of the body that the needle has to navigate through, from the skin and subcutaneous tissue, through the supraspinous and interspinous ligaments, between the lamina and spinous processes of the vertebrae, and finally into the subarachnoid space where the cerebrospinal fluid is located. We also walked through the step-by-step process of performing a spinal tap. We talked about the importance of patient positioning, sterile technique, and careful needle insertion. We also highlighted the importance of monitoring the patient for any potential complications, such as headaches, infection, or bleeding. Then we shifted our focus to epidural anesthesia. We learned that it's a technique commonly used in childbirth and surgeries to provide pain relief. The process involves injecting an anesthetic into the epidural space of the spine, blocking the nerve signals from the lower part of the body. We discussed in detail the procedure of administering epidural anesthesia. We talked about the importance of identifying the correct location for needle insertion, which is usually between the 4th and 5th lumbar vertebrae. We also stressed the importance of constant monitoring to ensure the anesthesia is working effectively and to manage any potential side effects. Finally, we compared and contrasted spinal taps and epidural anesthesia. We learned that while both procedures involve inserting a needle into the spine, they serve different purposes and target different spaces within the spinal column. A spinal tap collects fluid for diagnostic purposes, while epidural anesthesia delivers medication for pain relief. We also discussed the different risks and benefits associated with each procedure. For instance, a spinal tap can provide valuable diagnostic information, but carries a risk of headaches and infection. On the other hand, epidural anesthesia can provide significant pain relief, but may cause temporary numbness or weakness in the lower body. While these procedures may sound complex, they are a testament to the precision and complexity of modern medicine. Thanks for joining us on this journey through the spine.